Jennifer had an injury to her knee. She had been playing sports with her kids, playing soccer, and somehow twisted her knee and sustained an injury to a structure called the meniscus.
And about Sunday night, noticed the knee was a little sore and was swelling a little bit, but it was on Monday where it just, swelling just got worse and then never went down throughout the week.
She had a torn medial meniscus in her knee. This results in episodes of knee pain. The knee can swell, and she has difficulty doing the things that she normally does. Sometimes it's not just sports things. She has difficulty with daily activities, have trouble taking the kids to school, getting in and out of a car. Sometimes it can get to the point they have difficulty sleeping at night.
And so about after a week's worth of swelling and pain and not being able to bend it very well, I decided I probably needed to find someone to take a look at it.
Good to see you today.
How's your day going so far?
I chose Dr. Maffett because somebody had recommended him, and I did some research on him and found that he specialized in knee repairs, and then he also had a great experience in working with athletes. And then when I met him, he was fantastic. He was very warm, he was very sincere, and when I told him that I wanted to get back to my lifestyle, he's like, okay, no problem, we can get this done.
The torn meniscus in a knee is very common. We see it every day in our practice. The top bone is called the femur. It's a relatively round bone at the knee. The tibia below is a relatively flat bone. So here's the meniscus. This is the medial meniscus that Jennifer tore. And its function is to act as a shock absorber between the two bones. It makes the two bones fit together better. Once it becomes injured, it doesn't have a very good blood supply. So once the meniscus becomes torn, it really stays torn until you fix it. Some people can treat that by activity modification, meaning they do less and it doesn't hurt so bad.
Well, that's not an option. I've got 2 small children. I'm active anyway. That just wasn't going to be an option.
But if that's not acceptable to them, the only really thing you can do is do an arthroscopic surgery to fix the meniscus to allow them to do the things they want to do.
The people and the staff that I encountered at the Methodist Sugar Land Hospital were phenomenal. From the moment I registered and checked in to getting prepped in for surgery.
There are different types of meniscus tears that we run into. There are some types of tears that are peripheral tears, that are larger tears, that we actually will do a meniscus repair. We have instruments to stitch the meniscus back into place to allow it to heal. There are other types of tears in the non-vascular portion of the knee where we can't fix that. Stitches will not cause it to heal. In those cases, we'll trim out just the unnecessary part of the meniscus to contour the meniscus so it functions like it was before. You come in the morning, you get it done, you go home the same day. It takes about 45 minutes. During the arthroscopic surgery, we work through 3 portals. The top portal, we inflate the knee with fluid so that we can see. There's also a rotary shaver that we utilize to remove the unstable torn part of the meniscus from the inside. Jennifer had a tear of the medial or inside meniscus in her knee, and the rotary shaver is used to remove the unstable torn part while preserving the rest of her meniscus so it functions like it did before.
So this is just to kind of stabilize the meniscus and make sure.
When we do meniscal surgery, our eye is on to always preserve as much of the meniscus as possible because it's there for a reason. So whether we're taking out part of the meniscus or repairing the meniscus, our thought is to always preserve meniscal function as much as possible.
Coming out of surgery, was on crutches on Friday, didn't move around much on Saturday, but Sunday my niece was getting baptized, and so was able to go to that, walking on just 1 crutch, and so that was wonderful to be able to have that outpatient surgery so I could still be a part of that big event in her life. And then with some physical therapy, within 3 weeks I was back to my regular activities at my regular pace.